Hey everybody, it's Dr. Freels with Dr. Carter here. Today's topic is Achilles tendonitis.
Achilles tendonitis is an inflammation of your Achilles tendon. So that is one of the big tendons in the back of the leg that run down, connect onto the heel. And I tell patients all the time, it's the biggest, strongest tendon in the whole entire body. It crosses 3 separate joints. It's very powerful and really, really important, which makes it super important to treat it early.
If you have issues with your Achilles tendon, a lot of people end up with tight calf muscles here. So it starts here. Those tendons originate above the knee joint. It forms the calf, and then it creates the tendon here. It continues to insert down here at the back of the heel, but some of it swings around. So that's when it changes names. That's called the plantar fascia. So people that struggle with plantar fasciitis often also have Achilles tendonitis and calf issues as well.
Say pain in the back of the heel that's usually localized right in the back area.
Or even in here.
Yep, it comes up to that bowstring part. Doesn't usually come up into the calf muscle very much at all until it's really far gone and they've compensated a lot. It's tender with palpation. It's tender like squatting and bending up and down. Going up and down inclines or stairs seem to make it worse.
First thing in the morning too, when I had my Achilles tendonitis, I was waking up and it was so tight, it was uncomfortable, and not until that oxygen gets into the tendon and the muscle does it really loosen up. And so when we sleep, all of that constricts, so we're not getting as much oxygenation to the muscle tissue at that time.
Well, we start conservative, really. I like to get rid of the inflammation, and I can do that with some non-steroidal or steroidal medications. I also like to put you into a walking boot, and I know that can sound scary. However, if we don't stabilize a good chunk of that tendon, it's going to rip on you and you will need surgery. So if you think about it like that, wearing a walking boot is kind of a drop in the hat to get you where you need to be. That's kind of the basics for the conservative.
Well, now that she scared you to death by ripping in two, it's based on severity. If you come in and you have mild tendonitis, Achilles tendonitis, then we can put you in ankle brace. We can recommend shoe gear, compression, ice, the easy stuff that you've probably already been doing. But then again, we can elevate it if it's more severe to a boot, to a cast, anything like that. But we have some really cool modalities here that are not available in the rest of the state to expedite Achilles tendonitis healing and to get you back at it quickly.
Go for it. This is Dr. Freels' specialty, the regenerative medicine component.
So the first thing, number one, how painful is it? What are our goals? Do you have a timeline that we need to reach? Do you work on your feet all day? So with that being said, we have a really advanced method called DPMX, which is basically stem cells injected directly into the area. Now, when you inject steroid, which I highly recommend not doing, that's going to damage the tissue, can cause a weakening of the tendon and muscle as well.
Ready whenever you.
And I lost my train of thought. Cause fat pad atrophy. It causes the fat to deteriorate. So when we use something like DPMX, stem cell, we're actually promoting and repairing and regenerating healthy, fresh tissue, and most importantly, creating something called angiogenesis, which is essentially a highway of circulation to that area. Tendons are notorious for not getting a lot of blood flow, so anytime we encourage circulation to the area, we can really expedite your healing.
Laser therapy is one of my favorite modalities to use to restore blood flow to the area. Like Dr. Freels said, this area called the watershed on the Achilles tendon does not have a very good blood supply at all, and your tendon is very prone to ripping there, so don't be scared. So I love doing laser on it to actually get blood flow in there and give your body all the good nutrients it needs to help to repair itself.
The last modality that we have is called therapy. It's using sound waves to encourage circulation, again, that angiogenesis. It does that for up to 3 to 6 months. So if you've had an acute issue, Jesus. If you've had an acute issue or an injury, highly recommend doing that because it can take between 6 and 10 sessions. It's very quick, it's non-invasive, so it's not painful at all, and you can feel the healing immediately.
So there are some things we can do to help you prevent from getting an inflamed Achilles tendon or Achilles tendonitis. One of the most important things is stretching. Like Dr. Freels said earlier, keeping that oxygen flowing to the tendon, keeping it limber by stretching, that's really, really important for long-term success and keeping this from returning or preventing you from getting it. Orthotics are another thing. Controlling the structure of your foot will help to keep everything working the way that it should. Abnormal motion causes tendons to flare up and become overworked and inflamed. The more we can limit that motion, the better off we are. So orthotics are key. If you don't have yours, make sure you get in here by the end of November, probably around the 28th. It is a process. They're custom made for you, so we can't get them here overnight. So if you're thinking about doing it, now's the time. All right, I guess that's it. That's Achilles tendonitis in a nutshell. So if you have issues in the back of your heel and you think you need treatment or need opinions, you let us know.
Yes, definitely sooner rather than later.